Thank you for joining us today for the launch of the 2020 Invest in What Works State Standard of Excellence. To begin our event today, please welcome Bill McBride, Executive Director of the National Governors Association. Bill?
Thank you, and welcome everyone for joining today for the launch of the 2020 Invest in What Works State Standards of Excellence. And I hope that you and your families and your colleagues are well, safe, and healthy. For the governors and the governor's staff and other state leaders and governor partners who are joining us today, and on behalf of the National Governors Association, I want to thank you for your hard work to keep communities safe and healthy. We also want to thank you for taking the time to join us today for what promises to be, I think, a very insightful conversation. I know that these are very difficult times for everyone, especially those that work in state government. Both Results for America and the National Governors Association are aware of the many challenges you are facing related to the coronavirus pandemic in your states. In this way, the Invest in What Works State Standards of Excellence is an important tool to help governors address these challenges by highlighting what's working in the states. This allows those effective data-driven and evidence-based models to spread more widely. That's why we are so pleased to partner with Results for America for today's event to release the 2020 State Standards of Excellence, and more broadly to support governors and their teams. With the COVID-19 challenge, an increased focus on racial equity, unemployment, and other major issues, governors have a lot on their plates these days, but they remain laser focused on delivering results for their residents. The National Governors Association has responded to the needs of governors throughout this events by providing the information and communication they have needed when they've needed it. Through weekly calls with governors and their policies, specific calls with governors' advisors, the NGA is committed to speaking with one voice on behalf of all of our governors. COVID-19 is showing us that data, evidence, and science are critical to protecting the health and safety of state residents. So we thank you all for being here today to show your state's commitment to investing in evidence-based and data-driven policy. Further, the crisis disproportionately affects the more vulnerable members of our communities, which is why our conversation today is so important to ensure that we apply an equity lens for all of our work. This approach ensures that our programs protect all of our community members. You're in for an exciting program today, including a conversation with Minnesota Governor Tim Walz and a conversation with state leaders at the forefront of evidence-based policymaking and data-driven innovation. I want to make sure that our other valuable partners, particularly the Annie E. Casey Foundation, for their support of the National Governors Association. And thank you again to Results for America for their work in developing the 2020 State Standard of Excellence. And finally, thank you to all the governors and hardworking staff that work tirelessly every day to get better results in states across the country. We are so glad you could be with us today. And now it is my pleasure to introduce Michelle Jolin, CEO of Results for America. Michelle?
Thank you so much, Bill. And thank you to the NGA team, especially Tim Blute and Michael Britch, for your ongoing partnership with Results for America. On behalf of Results for America, I want to thank you all for joining us today. Everyone here today is a true believer in the power of data, evidence, facts, science to shine a spotlight on our nation's biggest challenges. The 2020 State Standard of Excellence is a tool to illustrate how governors and state agency leaders are rising to the occasion to meet the most urgent needs of our country. This is especially true in the time of crisis like we're experiencing now. The COVID-19 pandemic has spotlighted the importance of data-driven, evidence-based leadership like never before. As one example, 6 months ago, hardly any governors mentioned data or evidence in their State of the State addresses. Today, every state has a COVID-19 data dashboard, and governors are regularly providing briefings focused on the data from those dashboards. Data is also key to addressing our nation's racial reckoning and the need for governments to identify and dismantle the structural racism part of governments for too long. Data and evidence can help governments better understand communities' needs, continuously improve programs for all residents, use evidence to ensure that equitable delivery of quality services, and accelerate problem solving in all kinds of ways. In this year's State Standard of Excellence, we have 76 examples of how state governments are using evidence and data to advance economic mobility. Given how important evidence and data are to addressing our nation's real and great needs and the critical role that states will play in creating an equitable recovery, we're so glad to be releasing the State Standard of Excellence today. It's filled with examples that can be replicated, adapted, and scaled by all states across the country. Before I close, I wanted to especially thank our team member, Josh Anaba from Results for America. He's the manager of state and federal policy. He's been leading the creation of the State Standard of Excellence. He's been a valued member of our RFA team for years, and want to thank him for all of his contributions. I'd also now we want to introduce Cecilia Muñoz, a true leader in delivering results for our nation. From local communities to the White House, Cecilia has been leading the charge to empower those who are too often left behind. Cecilia also has written a thoughtful and insightful new book called More Than Ready, and it truly meets the moment we're in with wisdom and lessons that can be learned for our next generation. Personally, it's been one of my favorite reads during the quarantine, so I'll make that pitch to all and hand it over to you, Cecilia. Thank you.
So much, Michelle. Thanks for that warm introduction, and especially thank you for your leadership of Results for America. This is tremendously important work. And, we're learning more and more about why it's so important. So it's greatly, greatly appreciated. And welcome to everybody. I am so happy to be here today to talk with Governor Tim Walz of Minnesota. Under the governor's leadership, Minnesota has become a national leader in using data to improve services, to improve programs and outcomes for its residents. The state's response to the COVID-19 is a prime example of how important evidence and data are for key decisions that are being made in the state. So I know we're going to talk about that shortly, but I'd like to start just by briefly introducing the governor. Tim Walz is Minnesota's 41st governor. His career has been defined by public service, from serving our country in the Minnesota National Guard, to serving our students as a high school teacher and a football coach, to serving as a member of Congress. Through initiatives like the governor's Children's Cabinet and in the state's COVID-19 response, the governor's administration has prioritized interagency collaboration and evidence-based policymaking, these are our favorite things. So welcome to you, Governor.
Well, thank you, Cecilia. Thank you for the kind introduction. And I just want to give a hearty thank you to Bill McBride and the National Governors Association. All of us out here look to them as a repository of good information as we all are trying to make sure we handle COVID-19. And then to Michelle at Results for America. My predecessor, Mark Dayton, was very much invested in the idea of using the data and making sure that we were communicating it. So just really glad to be here with you today and want to say thank you.
Thank you. We're so grateful to have you. And, you are a governor in a moment of extraordinary crisis around our country. We're going to talk about that in a minute. But before we get into the really meaty stuff, I want to make sure that we spend a minute just helping our audience get to know you a little bit. So we're all working under very different circumstances than we're used to. I am working, from my home, as many of us are. Staying at home and working from home has changed my life in unexpected ways, including in my diet. So what's been the best food discovery for you during these times?
Well, for many of you, I always talk about, I spent most of my life never eating with adults. I supervised a high school lunchroom for 20 years, which was good preparation actually for this. But I think for me, I've got a 13-year-old going to be an 8th grader in the public schools and a 19-year-old who had to come home from her freshman year at the University of Minnesota. Family meals are our thing again. And I am enjoying it. I'm embracing it. And our children are. And I think they know in the midst of all of this how blessed we are to be able to spend some of that time. And I also get time to spend with my pets. And my story of my pets' eating habits are we have lost 7 Invisaligns and my glasses by the dog. So we're figuring that one out. But thank you for asking. I know, like so many of you, the strangeness of COVID, we try and find the things that are uplifting, and family meal time is mine.
That's lovely to hear. It's been true in my household as well. So let's talk a little bit about data. And in particular, you've been a strong supporter of using evidence, of the state in particular kind of making policy on the basis of the evidence. Can you talk a little bit about your kind of personal data and evidence journey, how you arrived at where you are?
Yeah, as I said, I'm a public school teacher, and I was teaching in the early 30 plus years ago in a small rural district in western Nebraska. And we had a T1 line, which some of the older folks on this line would know, that was only 2 in the state. And we used it because we were doing distant learning to other more remote school districts. And I also came across a tool at that time that wasn't out there very much, was geographic information systems. And to blend those into my geography teaching classroom, it was the first time my students were doing things with looking at how they could use data to understand social phenomenon like police calls. Or we did some work in famine early warning systems using GIS and data to put those together to let them understand these are data drives you and lets you ask the right questions so that you can make decisions that can improve lives. And so I got involved with that. It's probably not by chance. My wife is a data person and was the assessment coordinator around the data in a school districts for many years. And so we have been believers. We know that data alone won't do it. You need to put data in the hands of professionals. You need to understand what you're seeing as you disaggregate that data. But I've been a big believer early on. And I think the GIS experience is one that, as I watched how my students saw things so differently when they could show that data in a real life and a real time impact.
So wonderful to see how your experience as a teacher ended up affecting your experience as a policymaker. So getting to the COVID-19 crisis that we're all living through, your response efforts are relying heavily on evidence and data. Can you talk a little bit about how that's working?
Yeah, and I first want to say, in Results for America, a lot of us talk dashboards on here. This is the thing that's so fascinating, and I want to make sure, especially around a public health crisis, but amongst anything, if this data is given to people and put out there and used in a way to influence policy, it does the thing that all of us want more than anything. It gets buy-in. It gets social compliance. In the age of COVID, issuing a mask mandate is not nearly as powerful as people understanding that by wearing a mask, they're stopping the spread to their neighbors. And I think we understood very early on getting that out there. I start every morning with a brief that is data heavy, that drives everything from, and I have to guard myself about, you have to really understand the data before you can start making decisions about it. Because the first thing I get up and look at is, I look at case positivity rate, testing numbers, deaths, ICU capacity, PPE inventory, and supply chain, but understand how all those things fit together. And so early on, I think the lessons that we were learning as we were watching our fellow Americans struggle in Washington State and in New York, they bought us a little bit of time to use the data. This is the first time, and this is the home of the Mayo Clinic. We have a very extensive health system. We get really good results. I might say we get much better results if you're white. We get unacceptable results if you're a person of color. But with that being said, it was the first time we had a site picture into where are all of our ICU beds? Where are our ventilators? What would it take to move supplies? And what does our state stockpile look like? In many cases, the answer was we didn't have a good site picture. And I still think 5 months later, I so wish that I could pull something out of that data that was more concrete in the moment, but we are getting patterns. We are seeing that. So I think we depend heavily on that data to get in the hands of the professionals to help us interpret it and then describe to the public why we're making the decisions we're making.
It's just tremendously, tremendously important, especially now. I mean, this is, in some ways, the severity of the pandemic has really been an illustration of how important it is to be making decisions on the basis of data and to go where the science takes you. So thank you for that. I want to talk for a moment about how we might use data and evidence in the pursuit of equity. You just described the disparities that we see happening between communities with respect to folks' vulnerability to the virus. And of course, you're the governor in the state where George Floyd was killed. Since his death in Minneapolis in May, we've had an intense national conversation about structural racism. Can you talk a little bit about what the state's role should be in addressing equity for communities of color, and the role that evidence and data play in the quest for equity?
Yeah, it's foundational. We and when I say we, my Lieutenant Governor, Peggy Flanagan, is the first Indigenous woman elected to a executive office in the country, and someone who comes from a background of understanding that. We said that we needed to filter every decision we made through the lens of equity. And I think when a lot of people hear that, they think, well, what exactly that means? Some of the issues that led to what happened with George Floyd's murder and afterwards are decisions that were made decades ago. For example, building a freeway right through the Rondo neighborhood that separated the cultural heart of the Black community with no intention of including them. And I think we in Minnesota, and some of it is misplaced pride at times, but we rank very high, educational outcomes, incomes, if you're white. And I think George Floyd's death accelerated a conversation that was already happening, but in true Minnesota nice fashion, we bring these things up and then we ask each other if we want to have pie because it's just too uncomfortable to have the conversation. The data helps us have that conversation. They're demanding that we disaggregate this data to understand. It is unacceptable that a higher percentage of Black Minnesotans end up in intensive care than white Minnesotans with COVID-19. We also know those social determinants of health are out there. And now that there's no excuse for not using the data to drive you back down that chain to try and alleviate some of those. So I think here in Minnesota, the conversation, there was a big conversation about a constitutional amendment on education prior to COVID. And now with George Floyd, about how do you view policing? How do you view inequities? How do you view home ownership? And a lot of this is going to be, again, data has to be used with the human element in it, not to dehumanize. And I'm always very careful about this, to not use percentages. The idea that I often say is you walk into a hospital and the child that's laying there that was just born is white and the other is Black, I can predict with great accuracy who's going to live longer, their income and their home ownership and all of that. That is simply unacceptable. That's that structural racism that led to the explosion that you saw in the streets of Minneapolis and elsewhere. So we are committed to putting this forward. We're committed to not just admiring the problem, but it's going to take, and I just offer this to the Results for America folks of helping with us. A trend that I'm a little worried about is the manipulation of data to come to a predetermined decision, or the muddying of the waters around this. Again, we're not naive. The data is not going to fix COVID. It's not going to fix structural racism. But the data coupled with a commitment and in the hands of the public to try and get the outcomes they want, it can do that.
Thank you, Governor. So in the last year, your state has increased investments in evaluation. It's launched new evidence-based grant programs. What do you think has been the key to your progress? And what advice would you give to a governor who is at an earlier stage, who maybe didn't have the experience you had as a teacher, seeing how powerful data could be with respect to making decisions?
Yeah, I'll give you a working example of this. When I came in, and switching over to new technology platforms is the bane of every single organization. We know that. We had one that kind of drug on in our licensing system. And it had become a very political issue that government can't do anything right. We can't even get a license. This, the state that worked is how we viewed ourselves. And I brought folks in and said, let's have outside eyes on this. Let's have them come in and gather the data. Let's create a course of action based on that together. And these were legislators who said, I'm not giving you one more penny for that system, not one, no matter what. We're done. Well, by the end of it, we found a working solution. We were able to do it in a very cost-effective manner, and we've upgraded that system that's now working correctly. So I would tell governors on this is an incredible tool to get bipartisan buy-in if you want results, if you're just trying to get results. So I wouldn't be afraid of this. And I think the biggest thing is that the public may be distrustful in the first place, but share the data you can, but help them, not guide them, but help them understand what they're seeing and how that can be interpreted. And it does work. And in that case, we got bipartisan buy-in. We provided a service for the state and saved money, and did it based on the data that showed that was the direction we needed to go.
And what's been the most effective way to guide the public through the data to help make sure that they're understanding it and seeing it in an accurate way and in a way which supports their knowledge of the decisions that you're making.
Yeah, I think end users, and the thing is, and this is not surprising, and it's not a woe is me, trust level on elected officials is relatively low. Trust levels of professionals, whether it be in the medical profession, teaching, data, is much higher. And I think when you can bring in the dispassionate numbers, and I think this is what helps us with Results for America, of just giving an apples to apples comparison in the best way you can, and then let folks see that that's why it's happening. Because you're not going to convince them, especially in the age that we're in, if you just give them the trust me, this is what the data shows. So I think that, and I as a teacher, I have to continue to define new ways to articulate to the public why we're doing that and what this data is doing. They love the dashboards. If they can go onto a site and see how many days it takes them to get their driver's license renewed, and they see the progress that we're making, something as simple as that, it restores trust in the system to them.
And do you see evidence that it's restoring trust in the system? Like, do you kind of feel it as a governor?
Yeah, one thing, and I got involved with this as a member of Congress. If some of you, specialty courts used to be a hard sell for people because it's a belief we were letting people off, whether it was substance abuse or veterans courts. And I think once we started using data on that, some of the most strident opponents to the use of specialty courts have now become their strongest proponents. They want to see it done. And that was simply out. We could show them recidivism rates, we should show them cost savings, and we could show the impact. So for me as a teacher, I'm always talking a lot about Maslow's hierarchy. Sometimes we appeal too much to self-actualization rather than just take it down to the base level. This data makes government more efficient, it saves money, and it gets you results. And I think when we do that, the pushback is less than saying this is an ideology. Ideologically, I do believe in specialty courts, but if I just strip all that away from a strictly good policy and crime reduction, specialty courts work. So the data helps me show that.
It's a great, great example. So you the state of Minnesota is being recognized today as a leading state in the Standard of Excellence for Results for America, the document that we're releasing today. First of all, congratulations. That's awesome. Can you talk about what it means to you and what you think comes next?
Yeah, well, first of all, we're grateful that the outside validation matters because it goes back to our previous conversation. This is what helps people trust the system. These are the types of things that people, and last year, I think, and when this has happened before, I think my favorite critique was, well, why aren't you doing more? That's what they should be asking. Why aren't you expanding and doing this in more state agencies? Why aren't you building more dashboards? Why isn't this the standard? And our response to them is, we want it to be. So I think in a time of challenging budget times, I would just encourage my fellow governors, and I know you have to convince legislatures to do this. This is a smart investment of resources to move towards results-based outcomes. And there's going to be a desire of some to say, well, we don't have a luxury to mess around with this data thing you guys are doing. And the fact of the matter is we're starting to provide numbers as we go into a budget cycle. By doing this type of work, we've saved money. And here's where those savings can be put back in. So I'm grateful for this. We appreciate it. The one thing I know is that there's no pat on the back for this, but restoring faith in our institutions is going to be really important in the environment we're in. And I think one of the surest way to do this is this evidence-based plan that Results for America has been helping us understand. So we appreciate the partnership.
Thank you, Governor. I mean, I think of this as somebody who regularly describes myself as a policy nerd, and proudly so, that this is kind of the nerdy, wonky, in the weeds stuff. But we're also living at a time when, as you say, it demonstrates that something like specialty courts, which can completely transform lives, that they work, that they save money, that's really powerful. And of course, in this environment where we are, struggling to contain a virus, is a case in point as to why policymakers need data. So we thank you for that. Thank you for being an evangelist for this cause, and more importantly, a practitioner. So we just really applaud you for your commitment to excellence. We thank you so much for joining us here today. And we're going to move to our next session with many thanks to the governor. I'm going to turn the microphone, as it were, over to Results for America's Josh Inaba to share the Standard of Excellence and its findings. Thank you.
Thanks, Cecilia, and thank you, Governor Waltz. I just think those remarks are absolutely on point and totally reflective of the work that Results America is supporting. And, I think it'll echo a lot of the thoughts that we'll hear later on today. As a part of today's events, we are launching the 3rd annual Invest in What Works State Standard of Excellence. I'd like to thank the many state government leaders on the call today, as well as our State Standard Advisory Committee, or What Works Bootcamp participants, for their partnership and engagement with the Results America team over the last year to develop the State Standard of Excellence. The state standard is it's a great opportunity for states to really highlight and show the great work that they're leading across the country. So we're really thrilled to have such strong engagement over the last several years. I'd also like to thank a few of my colleagues, Jed Herman, Akshay Modi, Quinn Stevenson, Jack Monahan, and Ned Flanagan for their work on the standard as well. They've done an excellent job. Just at a high level, the Results for America Invest in What Works State Standard of Excellence does 3 things. One, it sets a national benchmark for the data and evidence infrastructure needed in state governments. We highlight examples from across the country in many states and state agencies. And at a very high level, the State Standard of Excellence provides a roadmap for all state government leaders about how they can increase their capacities and abilities to invest in what works. So this year, in our 2020 State Standard of Excellence, we're identifying 169 data-driven and evidence-based examples in this chart, which is also in the standard and on our website. You can take a look at it. We're showing sort of the growth over time across sectors. So as you can tell, we've elevated from across the country a growing number of examples in child welfare, criminal justice, economic mobility, education, health, and workforce. And we also describe some of the broader evidence building capacity that's happening in states as well. As we've heard a lot today, while we were putting together the State Standard of Excellence earlier this year, one of the key issues that came to the forefront for our team and for a lot of the states that we work with is that COVID-19 is playing a key role in shaping their policies, especially today. So in the State Standard of Excellence, we have outlined basically a few key findings. One, that all 50 states launched, as we talked about earlier, or had some form of a data dashboard. And we also dug a little deeper. We tried to identify some of the exciting and innovative data-driven practices that are supporting the use of data. And so in the State Standard of Excellence, we have 31 examples of data sharing infrastructure, data-driven innovation, data integration that have really supported some states around really rapid and effective responses. So you can read more about those in the State Standard of Excellence, and we'll also talk a bit about more of them in the panel. Another key finding that we talk about in the state standard this year is evidence-based budgeting. I think just as the governor referenced and as Cecilia talked about, I think states are going to be in a position of having to make some critical budget decisions. So in the State Standard of Excellence this year, we characterized some very mature evidence-based budgeting models in a few states like Colorado and Minnesota. We also talk about and describe some of the upcoming and promising practices coming out of a handful of states around evidence-based budgeting. So I think seeing those examples and hearing what some of the promising practices can be great indicators for models that states should consider replicating as they face these critical budget challenges. Finally, I think earlier this year in July, we launched a blueprint for delivering results in state government. As you know or have read, the State Standard of Excellence has 15 different criteria that capture the data and evidence infrastructure states and state agencies should have in place to drive their policy and budget and management decisions. So our blueprint for delivering results in state government serves as an implementation guide for a lot of these criteria, for all these criteria, in fact. So you see here we have 4 specific themes. We really encourage states and the folks in this room to consider the State Standard of Excellence and the blueprint as very complementary resources. They're really designed for states to take some practical, tactical, and strategic action around these key criteria, so they can not only achieve some excellence in state standard, but also become very effective organizations that are really focused on continuous learning, improvement, and results. And I believe we will send around a link to the blueprint in the chat function. With that, I'll now turn it over to my colleague, Jed Herman, to announce the 2020 State Standard of Excellence Leading and Honor Roll States. Jed?
Thanks, Josh, for the overview of the State Standard of Excellence and for your leadership in developing this year's report. These findings show that nearly every state has made important progress to use evidence and data to inform their decision-making and improve results in 2020. This builds on the work that states have been doing in recent years since we began tracking this work in the first State Standard of Excellence in 2018. Since that time, the average number of examples per state has increased by 50%. This is good news because it shows that states are increasingly investing in what works, but it also means it was a very tough competition this year for the leading state title. In fact, in 2018, the top leading state had 7 examples in the State Standard of Excellence, whereas this year, the top state had 12 examples in the State Standard of Excellence. So the bar is rising to be a leading state. We congratulate all states on their progress. But now, for the moment that you've all been waiting for, the official announcement of the leading states in the 2020 State Standard of Excellence. This year, there are 7 leading states that are showing the way with their use of evidence and data to get better results for their residents. These 2020 leading states are, first, Colorado. Here to speak on behalf of the governor is Lauren Larson, the director of the Governor's Office of State Planning and Budgeting. Lauren?
Thank you. It's a pleasure to be here. And on behalf of Governor Jared Polis, great thanks to NGA and Results for America for elevating what is typically a behind the scenes sort of thankless type of work, and this effort that you've undertaken is really elevating it in our state and around the country. So thank you. And I guess I'll speak from the governor's quote here is talking about the response to COVID. And as Governor Waltz said, we're heavily data driven. In my world specifically as the state budget director, I'm thrilled with how we've been able to change the culture in budget development to bring data and evidence to the point of decision making. So this matters a lot when you're expanding a budget. You want to invest in the highest ROI, but right now we're contracting our budget and we want to be careful. We're not making decisions that are penny wise, pound foolish, and data and evidence is really supporting us there. Our governor's has an evidence meter, so every key decision we are bringing to him on budget, he's evaluating it on our evidence meter, and then we have that common parlance and discussion points with our joint budget committee for when we elevate our requests to them. So it's really become part of the culture, and we're deeply honored to be a leading state. Thank you.
Thanks, Lauren. Appreciate those remarks. You can read all about Colorado's evidence-based budgeting work in this year's State Standard of Excellence, including specific links to the resources that Lauren just mentioned. With that, I want to turn to the next leading state in the 2020 State Standard of Excellence, which is Minnesota. Here to give a few remarks is Weston Merrick, the Impact Evaluation Manager at Minnesota Management and Budget. Weston? Weston, are you with us? Weston may be having some technical difficulties. Let's move on to our next state. The next leading state in the 2020 State Standard of Excellence is Tennessee. Here to offer some remarks on behalf of the governor is Adam Jarvis, Deputy Director of Customer Focused Government for the state of Tennessee. Adam?
Yes, thank you, Jed. As Lauren said, greatly appreciate all of the work that Results for America and NGA has put in to providing this amazing report this year and in all previous years as well. We're also deeply honored to be recognized as a leading state this year. And as others have already shared this morning, all of this in terms of data and evidence and using data and evidence allows Tennessee to make better decisions and drive better outcomes for the people of Tennessee. And we're excited about that, excited to be recognized as a leading state today. But most importantly, I think the transparency that we're able to offer by putting this out for people of Tennessee leads them to asking better questions. As the governor said this morning, this allows folks to make better decisions, but ask better questions and be informed about state operations. Again, thank you so much to the Results for America team. We're deeply honored to receive this recognition.
Thank you, Adam. And you can read all about that. Transparent Tennessee is highlighted several places in this year's State Standard of Excellence. So thanks, Adam, for your efforts. With that, I want to go to the next leading state for the 2020 State Standard of Excellence, which is Utah. Here to offer a few remarks is Rachel Stone, who is Utah's Chief Data Officer. Rachel?
Hi, thank you, Jed, and thank you to the Results for America team and NGA. We're honored to receive this recognition now for the last 2 years and have learned so much in participating in this process with you and learning from our fellow states' excellent examples. We have a lot more to do, but here in Utah, data and evidence really fuel our policy decisions and our operations on the ground. We put a lot of thought and weight into this across our whole government to provide the right and meaningful indicators at the right time to the right audience to help both leadership and our frontline staff make decisions. So our goal is to maximize value and outcomes for every taxpayer dollar. And we are definitely feeling the need for that with the current situation with COVID and our economy. And so we're grateful now to be able to say that the work of previous years is paying off. And we thank you again for your support of that and know that there's so much we can do. So hope to see you next year.
Great. Thanks, Rachel, for those remarks. As Rachel mentioned, Utah has been a leading state 2 years in a row and really, I think, seen their infrastructure, as she noted, come in handy for COVID-19. With that, I want to move on to the next leading state in the 2020 State Standard of Excellence, which is Washington. To offer a few remarks, here is Mandeep Kondal, who's the Deputy Director of Results Washington. Mandeep?
Thank you, Jed. Thank you, Results for America and NGA team. We appreciate your guys' guidance and collaboration very much. And on the behalf of our state, we are very grateful and honored to be recognized as a leading state in this year 2020 State Standard of Excellence report. As a result, Washington, we continue to lead our state's focus on results. This recognition is an encouraging news to us and my colleagues. And we are also looking forward to connecting very much with our peers across states and learn from their successes. Thank you.
Thanks, Mandeep. Really appreciate your work in Results Washington there. I understand that Weston is back on from Minnesota. So why don't we go back to Minnesota and I'll welcome Weston Merrick to give a few remarks. Weston?
Thank you so much, Jed, and sorry for the tech issues. We're really humbled to be recognized as a leading state by Results for America. As Governor Walz shared, we do this work because Minnesotans expect and deserve a government that is efficient, effective, accountable, and that strives for equitable results for all of our residents. To deliver on that promise, we have to use the highest quality data and evidence that's available. So we're really proud of the progress that we've made here in the state over the last couple of years. We know that there's a lot more work to do, and are grateful for Results for America for pulling together this report and this session so that we can learn from many of the other excellent things that states are doing across the country. So thank you so much.
Thanks, Weston. Thanks for joining us. And thanks again for Governor Walz for spending some time with us today to talk more about Minnesota's approach to using evidence and data in their policy making. With that, I want to move on to the next state in the 2020 State Standard of Excellence, who is the leading state, which is Connecticut. No one from Connecticut is able to join us today. And finally, to the final state that is the leading state in the 2020 State Standard of Excellence is Oregon. Congratulations to Oregon and all the states that are leading in the 2020 State Standard of Excellence. You can read more about their work in the state snapshots that are linked in your chat box. With that, I'd like to introduce the 2020 Honor Roll states. There are 4 Honor Roll states that have demonstrated a commitment to growing their use of evidence and data. The 2020 State Standard of Excellence Honor Roll states are Massachusetts, which went from 5 examples in the 2019 State Standard of Excellence to 7 examples in 2020. North Carolina, from 4 examples in 2019 to 7 examples in 2020. Ohio, from 5 examples in 2019 to 7 examples in 2020. And Rhode Island, from 3 examples in 2019 to 7 examples in 2020. Congratulations to all of our honor roll states for their great work, and to our leading states as well. Now that we've heard about the findings of the 2020 State Standard of Excellence, we have the opportunity to learn from the state leaders that have been leading this work about how they're using data and evidence in their COVID-19 response and recovery work. So with that, I'm going to pass it back to Cecilia Muñoz to moderate our panel of state leaders. Cecilia?
Thank you very much, Jed, and congratulations to the states. And I'm very excited about the conversation that we're going to have. So these findings are tremendously important. You've already heard and really seen and are no doubt living how important data and evidence are in keeping the community safe and in advancing our collective objectives in this democracy. And you've seen, and this report documents, all of the great progress that state governments are making using evidence and data. So now we want to get a better idea of what this really looks like on the ground by hearing from the people that are actually leading this work in key states. So we know, for example, that data is helping drive states' responses to COVID-19. We know, we talked with Governor Waltz about how states are using data to improve racial equity. So we have a great group of panelists that represent a variety of perspectives on these issues, given their experience in governor's offices, budget offices, state agencies focused on education and health. So I want to say to our participants, there are a lot of you on the call. We're going to have time at the end of the panel for Q&A from the audience. Please use the chat box to put your questions in at any time during the session. I'm going to be moderating and keeping my eye on the chat box so that I can weave in your questions. And I will dispense with the introductions of our group. You can see them on the slide. So I'm hoping that they have turned on their cameras and their microphones, because we are going to just dive right in. So I'd like to start with Matt in Connecticut. There you are. We've already talked a little bit today about how data have an enormous impact in responding to COVID-19. You're the state epidemiologist. You've been at the center of the state's response efforts. Can you talk about how the state has been using data to inform decisions?
I'd be happy to. And I'd also like to thank, on behalf of the governor, the recognition for today. I've been investigating outbreak and epidemics in Connecticut for 35 years. And we have never had to deal anything like what we're dealing with right now. Nothing like this has happened in 100 years. But there's also a different set of expectations. Like the other panelists today, I'm one of the people that works behind the dashboard, in that world behind the dashboard, trying to figure out what are the questions we need to get answers to, and what stories do we need to tell. Because data alone, just showing data alone, we're not doing our jobs if we just show the data. We need to be able to say what it means, because it doesn't become information until we actually try to explain why these data are important. Clearly, for most epidemics, we start out with how many people are sick, how many people have been hospitalized, how many people have died. Very simple questions, but really complex to answer in practice. And if you look at the last pandemic in 2009, which was influenza, states put out weekly updates related to that pandemic, and so did CDC. And that was really the benchmark for the last 25 years, weekly updates. When this one started, and Connecticut was one of the, was part of the greater New York City outbreak, daily updates in real time for those numbers were expected. And epidemiologists in my program worked with others in other state agencies to put out updates at 4 o'clock every afternoon, 7 days a week from the end of March all the way till July 1st. That's when the governor said we could take the weekends off and only put out reports Monday through Friday. But this is really, truly extraordinary. But also this epidemic, this pandemic has sort of torn back the curtain on many things. And as you talked about earlier, the issues of race and ethnicity. And after answering those initial questions, people then asked us, well, who's getting sick? And that's when we had to turn to our data, which is imperfect. The data that we get from laboratory reporting, only less than 50% of all the disease reports that we get from labs actually have race ethnicity data. And this became a very important issue as it became increasingly clear that people of color were more likely to be hospitalized and to die from this disease. And this was an issue for us, but also for everyone. And suddenly, people were looking at our data in ways they'd never looked at before, because they were saying, well, what do you mean you don't get this data? You say, well, if a person goes for a lab test, they're usually not asked about their race and ethnicity, and it just doesn't wind up in the system being reported. So these are really important questions. And as things shifted, I'll be brief, but reopening, and different states have different terms for what we've all been going through, but in Connecticut, it was called Reopen Connecticut, had a whole different set of data needs related to it. You know, how do we determine when it's safe to reopen? You know, a stage 1 or a stage 2 or a stage 3. And our data were being used in a different way. And public health data has never been more important than now. And I'm sure my other colleagues here today will echo that sentiment. Thank you.
Thank you so much. Frank, let's turn to you over in Ohio, because Ohio's been a national leader in merging data from various parts of the state government in ways that really helped position the state to respond and to use data in some of the ways that Matt just discussed, right? I've learned through dealing with other health crises that frequently we have pockets of data that are owned by different agencies, but making sure that the data can kind of talk to each other helps us get a more complete picture. Can you talk about what Ohio's done to merge data statewide and how you did it to inform the COVID-19 response in particular?
Yeah, absolutely. And to echo Dr. Carter's statement, thank you for RFA and NGA for the great work with the state standard of excellence. I've learned a lot from it, and I'm excited to leverage that resource to continue increasing Ohio's ranking and getting more and more examples. So COVID is definitely a big multi-agency data integration project. As Dr. Carter said, the shutdown data needs versus the restart data needs were tremendous. Multi-agency in an effort in Ohio is called the Innovate Ohio platform that was signed with an executive order from Governor DeWine back in April of 2019 that really started requiring agencies to onboard to a state cloud environment. And thankfully, our Ohio Department of Health was one of the first large agencies to onboard. So our disease reporting systems, nonviolence, injury prevention data systems were already on. So as we were starting to intake either hospital capacity, PPE allocation, tracking outbreaks in the prison systems, trying to protect our senior living homes, all the different facets of the COVID response came a little bit easier for us. It's still not an Excel spreadsheet, but it helped determine and give us the data that we needed from very early on. For all the participants and folks calling in, I would refer you to coronavirus.ohio.gov. It's got all the resources through the first press conferences, through the iterations of the dashboards, and the executive orders and the public health orders to really show Ohio's response and how, in early February, we were starting to track how are we going to start to intake all the different cases and tracking it across the state. So coronavirus.ohio.gov, there's a lot on there. And then really it's the leadership of Governor DeWine and Lieutenant Governor John Husted. Governor DeWine had a great quote early on in the early press conferences that said, mistakes that I've made throughout my career have generally been because I didn't have enough facts. I didn't dig deep enough. So I made up my mind I was going to have the best information, the best data available. And that's really where the Innovate Ohio platform comes into play. Through the shutdown, but then also being able to spin in maybe unemployment, really a lot of unemployment numbers through the restart. feature, and now getting into, a county level advisory where we've got 7 different indicators. So we're not doing a statewide response. It's very localized and very focused now that we've got the data together.
Thank you. Let me turn now to Allison from Pennsylvania. So we've seen in recent months that data and evidence can be really powerful tools, but those terms often mean different things to different people. So before states can deploy tools to get impact, they have to do some behind the scenes work to define terms, to get everybody on the same page. Can you talk about how you've been doing that in Pennsylvania, particularly with respect to how you're using evidence in your workforce development initiatives and how you think that might help the state meet the needs of folks who are unemployed and struggling economically in this crisis?
Yes, thank you for the question. So for some time, Pennsylvania has been on a journey to build a more data-driven and evidence-based workforce development system. And this is a highlighted priority in our state plan under the Workforce Innovation and Opportunity Act, and builds on our commitment to make sure that data on our workforce outcomes is more accessible to the general public. So to build on this work, in May, the Pennsylvania Workforce Development Board, which is our state workforce board, took an important step in defining evidence standards for workforce development that we will be using moving forward to evaluate our investments and our workforce initiatives. We started this work last fall in partnership with Results for America, learning from the experiences of our peer states, some of which are here today, highlighted in this work, socializing this evidence building concept with our workforce stakeholders, and vetting it through the committees of the state board before bringing it to the full workforce board. And it was important for us to go through this process and lay this groundwork because there was some initial fear from our workforce partners about what this, what defining evidence would mean and what it would lead to. And for us, it's not about stifling innovation or cutting funding or ending programs, but rather highlighting the value of and the positive impact of evaluation to help us more effectively use our limited resources and improve workforce outcomes for Pennsylvanians. Ultimately, this kind of shared understanding about what evidence is and how we define it will help ensure that the whole system is moving in the right direction. And this is important because we're setting state policy, but our workforce development system is really locally driven. And so it's important that, at the state level and the local level, we're in sync. COVID obviously has created some unique workforce challenges for states. We have historic unemployment. We have certain segments of the workforce and certain industries that have been disproportionately impacted. We have to accept the reality that some jobs may not come back after the pandemic is over, and states have growing budget deficits. That's something we're going to have to deal with later in the fall. And we have more workforce customers than ever before. So by taking a fresh look at our investments and prioritizing evidence, we can, ensure that we're reaching not only our workforce customers impacted by COVID, both the job seekers and the employers, but also our new customers, the customers that were engaging in the system before the pandemic. And, ultimately, by prioritizing strategies with proven success, we hope that we can maximize the impact of our resources, but improve outcomes as well.
Thank you. It's a great example of how important it is to sort of break through the old model of standing up programs and make sure that we are measuring whether or not the programs are actually achieving their purpose. In a time like this, that becomes more and more vital. So Kristen in Tennessee, turning to you. You've made progress in Tennessee, similar to what Pennsylvania has made. One of the major achievements for your state is your office, the new Office of Evidence and Impact. Can you talk a little bit more about what that is and what you're doing to drive evidence budgeting forward in light of the COVID-19 and economic impact?
Yes, and first let me say thank you to RFA, NGA. Really honored to be here representing Tennessee and the great work that we're doing around data and evidence. So we're very fortunate actually in Tennessee to have a solid history of using data and evidence in our decision making. Our Office of Customer Focused Government, for example, that has been in place for a number of years, has really paved the way when it comes to really making performance management and the use of data a part of our culture in Tennessee state government. The Office of Evidence and Impact, to your point, is new. We were created just in 2019, so for less than a year we've been around, but our focus is on using evidence, data, and evaluation to inform policy makers in Tennessee so that we are arriving at the best outcomes for Tennesseans, our population here in Tennessee. We're doing this in a few different ways. So we have three main buckets of work. One is that we are starting on the process of working with our individual state departments to inventory all of their programs and catalog the evaluation, the evidence that exists for each of those. So we've been able to do a lot of highlighting the good work that's already been done by a lot of our agencies, but also identified opportunities to engage in additional evaluation where perhaps there hasn't been as much. So we have found that work to be incredibly helpful, and we are engaging in making the results of our inventory transparent by putting those on our website, that Transparent Tennessee webpage that actually was mentioned earlier today. We are also very, very heavily focused, especially these days, on evidence-based budgeting. I have been engaging with folks from all of our departments on a couple of fronts actually related to evidence-based budgeting in these times when we're in a pandemic. Our team has put together, actually initially last year, just a form, an evidence-based budgeting form for departments to use for cost increases. We find ourselves, like all states, in a much different economic situation today. And so we've created a reduction form as well for departments to fill out. So we have these evidence-based budgeting tools that our agencies are using as a part of the process now. And we're able to take what we learn from what they provide and share that with the ultimate decision makers in state government, so that they're aware of what evidence is behind the programs when they're making these important budget decisions. But then also we've been collecting even further program inventory information from departments as a part of this exercise that we're now facing with the revenue shortfalls that I know we're all dealing with nationwide. But so those are two ways that we've really been trying to inject evidence into the budgeting process and provide our leaders with the information that they need to make good decisions. And then finally, we are very, very focused with our Office of Strategic Technology Solutions in Tennessee on engaging in greater data sharing and data analytics on an enterprise-wide basis in Tennessee. So we have just started those efforts, and we are continuing to work with those folks within Strategic Technology Solutions, also our governor's office, to really foster that continued sharing of data and really change the culture around data sharing in Tennessee. And those are some of the ways that we have been working on those three areas of work that we're focused on, but then also contributing during the COVID-19 pandemic to the budgeting process.
Thank you so much. And it sounds like enormous progress, and probably challenging to make that progress in a time when folks are not going into the office to be able to do the work. So thank you for that. Brooke, let me turn to you in Oklahoma to sort of clean up for the panel. We've talked about different aspects of the COVID-19 pandemic, but we haven't really talked about the educational aspects of it. The state education departments have enormous decisions to make. Can you talk a little bit about how you're using data and evidence to drive the decisions related to the new school year?
Yes, thank you so much for having me here today. You know, as you can imagine, as soon as COVID hit and states were making the decision to stop having school for a time and begin to plan for distance learning, the major concern was connectivity and where carriers were across our state and across our counties, what areas were even covered, and then what schools had in terms of connectivity with devices, and then all the way to what was in the home. And so even our districts who would say, well, we're a one-to-one district or we're a one-to-one school, all of our students have devices, we'll be fine. That doesn't mean those students know how to use those devices when they're home. And it also doesn't mean that there is enough connectivity at home. And as all of us probably learned, we think we have high-speed internet until we have 3 people in the same home on a Zoom call all at one time, and then it's not quite as high speed as we thought it was. So we had a lot of focus on using data from multiple measures. So not just looking at areas of coverage from internet providers across our state and across our counties, and not just looking at the numbers of devices that schools felt like they had already deployed or communities were deploying. We really had to look into those homes and look at surveys from parents and ask very pointed questions like, how fast is your Wi-Fi if you're watching a movie? How many people in your home can watch a movie at one time, can stream a movie at one time? What does that look like? And so all of that information really helped us come together and to talk about how we could best use our CARES Act funds. And so we had some formulaic side that all schools were able to do some things, but we also had some competitive funds for those who were in the most need. And the districts had to prove that they were in the most need from using this data, that some of which we had provided, but a lot of which they had gathered from their stakeholders. So bringing together those multiple measures, I think has been a really important piece in getting through this time. And of course, that was all done in emergency fashion. And at the time, we developed some tools for them to use. One of those was a rapid response tool so that schools could begin to turn around looking at needs assessment in terms of 4 weeks at a time, as opposed to a school year of needs assessment, and looking at their data 4 to 8 weeks at a time of, have we achieved that? Where are we ready to go now? So that was another important piece of how we use that data. And then finally, Superintendent Hoffmeister was committed to having public education meet public health. And so looking at all the data from our health department by county and coming up with a response from schools based on the color coding system that we were receiving from our state that were countywide coding systems. And so that really helped us determine, in working with epidemiologists and working with our Department of Health, if we have a county that is in yellow, what should the response at school be? And that has helped us in making our return to learn decisions about whether we're returning in person, in a blended model, in a half and half are here for a little bit and half are here for another little bit, or complete virtual in some cases. And so without that, look at the data to really determine that, we felt like we would just be trying to recreate school as we always have, instead of using this time and using this data to really move us along towards some blended models and towards some models that might actually be more customer friendly for our students and our families.
Thank you so much. These are enormously consequential decisions. It's really reassuring to see these kind of thoughtful approaches. So if folks have questions that you want to put in the chat for Q&A, we only have a little bit of time. So I might just propose, while we watch to see if questions come in, a quick lightning round for our group, and to maybe describe just one thing in your kind of data journey that has surprised you. So to give that some thought for a second, and I'm going to turn to Frank first. Before you tell us what you might have surprised you in the course of your work, I have a burning question, which is that your title is Chief Data Advocate, and I would love to know how you define that role. What exactly does that mean?
Think of it like a senior policy advisor, I guess. That's what I used to have at the state auditor's office. There was a state chief data officer under our Office of IT and Administrative Services, who really led the technology. We call it the Innovate Ohio platform team that does the websites, the identity, and the data analytics. And then I kind of come in and help the agency's senior administrations, the directors, chiefs of staffs, and others kind of connect the dots between the projects maybe they've done in the past where we can knock the dust off maybe a 3 or 4 year old report and start to operationalize it and build out those data analytics projects so that it's not just a snapshot in time, that we've got the technology now to make and match and connect the dots to show ongoing progress for certain programs. And then something that's interesting with data, was that the question?
Something that surprised you.
All right, so I kind of sharpened my teeth in financial transparency in Ohio, and I had to begrudgingly get local governments financial data from them, and I would post it online, creating about 1,200 checkbook sites. In the early days, it was easy because those folks who wanted to do it. Later down the list of the 4,000 governments in Ohio, more and more didn't really want to do it. And so when I came into the Lieutenant Governor's office and the executive order to consolidate and integrate the data systems was before I jumped on board. So I was really excited, like, how are agencies taking this requirement now? And so something that was, unexpected was they're all on board. They want to do this. They're looking forward to it. Right now we're trying to get as much capacity to onboard as we can, more staff. So that was really exciting because I thought some of them might throw their hands up, especially some of maybe your social health services say, yeah, this is my data. I'm not ready to put it on your platform yet. But they've all been very willing and very helpful. So it's exciting.
Thank you. Dr. Carter, how about you? Anything that's just surprised you? Do you have any memorable stories of something you weren't expecting from the data? Whoops, you're muted.
Sorry for that. One of the things I didn't expect was that we would have a plethora of COVID tracker sites that people have their favorites. And if you go to and look at the fine print, it says, this website claws data from every state health department website. I just didn't see this coming. It's not a CDC, it's not a governmental website. These are run by organizations, Johns Hopkins, academics, Harvard. I didn't see this one coming. The other thing I didn't see coming was that every modeler in the United States would decide to put their model online, predicting, trying to forecast what was going to happen. And people have their favorite, model websites that they go to. This is something that I'd never seen before, and I think will be something we need to reflect on when this is over.
Thank you. Kristen, how about you? Any surprises?
I think this really speaks to what the two previous panelists were saying, just with the pandemic in particular. What we have seen is such an explosion of the use of data and data analytics and forecasting in decision making, but then also to the previous point from think tanks, from universities, that are all in there providing this valuable data to anyone at the click of a mouse. And so it is stunning to me, while I knew that we have been on this trajectory as a nation of having to focus more and more on data and evidence in all that we do, not just within state government, but then to just see how that has been amplified and highlighted throughout this COVID-19 situation has just really been stunning, and I think has even created an environment where there's even greater buy-in from folks. Frank was talking about sort of that buy-in, and I think that we're now in a place where people just get it.
Nice, thank you. Brooke, let me turn to you. Any surprises in the course of your work?
I think it was surprising that we knew that the pandemic would reveal inequities, but I think the extent and of those inequities was even more than we had thought in the past. And so just having more and more people say, I really want to know what has happened in my district up to now, what is happening up to now, where are those students going? I feel like we are much more focused on every single individual student based on data of where they are in their life right now and how we can help them move forward as we return to learn. I think that's been the most surprising thing.
Thank you. Allison, your turn to back cleanup. How about you? Surprises?
Well, I'd like to echo some of the comments from my fellow panelists. I think something that surprised me is, you know, every decision that we've made as a state to respond and mitigate the spread of COVID-19 has resulted in a lot of scrutiny, and all eyes are on us, and everybody is interested in knowing the data and evidence that underpins these decisions. I think it's forced us as states to kind of translate public health data into something that's digestible for the general public. So it's easy to understand and they know why we're suggesting a certain approach. And I really hope, I was surprised by, you know, the public interest in that real-time data. And I really hope that it, that interest continues, that we as states do a better job of translating the data and what it means to our fellow residents, and that they feel empowered to use that to help inform their own decision making beyond the pandemic.
Thank you. So with that, let me thank this panel. It is, you know, just as an American living through this crisis, I find it incredibly reassuring to see the kind of public servants that we have working on these issues. And as you really all noted in one way or another, this is a moment in which sort of the notion that data is essential if we're going to govern well and if we're going to do our job in protecting the American public is really visible in a completely different way now. So thank you for sharing your expertise with us, and thank you especially for the work that you do in your states. And with that, let me turn it over to my colleague, David Medina, who's the co-founder and COO of Results for America, to close us out. David?
Great. Hopefully you can all see and hear me.
We can.
Great. So Cecilia, first, thank you for moderating today's discussion and for your years and years of work making our government more focused on outcomes and evidence. And thanks to Governor Waltz and all of our panelists. We hope all of you know that you've made us more hopeful today, that there are people like you building and using evidence and data to address our nation's economic crisis and pandemic. So thank you. Thanks to the National Governors Association for the years of great partnership, and we look for even more years down the road of joint collaboration. Thanks to the members of the Results for America State Standard of Excellence Advisory Committee members who helped review and analyze all of the information that we gathered from all across the country. Thanks to our RFA team for months of work learning about all of these great leading and promising examples. We have the best team you know, in the United States. So thanks all of you. And again, we hope you will take a look at our standard and more importantly, equally importantly, we hope that you all continue to have a safe and healthy summer. And we look forward to continuing to work with all of you. So thank you so much for joining us today.